Hey guys, welcome back to another podcast. Welcome back to another Rep Path podcast. Today we're going to talk about the territory surgeon. Okay, so just like a doctor doesn't just walk into an OR and operate, same as a sales rep, guys. We don't just take over a territory and just run around. You need to act and diagnose with precision to make sure you're just as effective as a surgeon is in a case. So we're going to talk about that today, guys, and break down different aspects to how to effectively run your territory. But before we do, as always, guys, please make sure if you have any questions, submit them right into the chat, and we'll address them about halfway through the show. Secondly, guys, we talk about it every week, and I need you, if you're struggling, because I see you guys on LinkedIn, you're looking for jobs month after month, still as an aspiring medical sales candidate. If anybody has that as their title, and they've been doing that for more than 2 months, you need to contact us at the Rep Path Academy so we can minimize your frustrations and help you break into this industry. So click the link, reppath.com, so you can schedule an appointment to discuss more with me, or shoot me a DM right away. We'll walk you through the different steps and strategies on how to break in. You could see here on the website, reppath.com. You'll see it up there on the screen. These are the different companies we've helped place with, which are all big names. We obviously work with hundreds of companies all around the country, and the testimonials of reps that have placed through our academy. Lastly, guys, if you want to see a copy of this podcast or any other material that we have, please go on my YouTube channel, the Rep Path Academy. Click the link below and subscribe. It's 100% free. You'll be able to get a copy of this recording and everything else we produce here at Rep Path. You could see we have a ton of material, guys. I know reps that thank me every other day that didn't even join my academy because they've picked up great tips in here that help them, in a final interview or anything else along the process. And they're constantly thanking me, for the education that we give them and the content we provide. So let's dive right into it today, guys. Territory surgeon. Okay. So just a corny little analogy comparing what you need to do to be an effective sales rep in a case. Just like a surgeon, you need to diagnose, prioritize, and operate with precision and follow up with discipline. So one of the first things we're going to talk about is diagnose before you prescribe. Okay. So we've all been there, guys. You have a little issue going on, a little cold, fever, your stomach hurts. You go to the doctor. The doctor doesn't go, no, I don't need to hear anything. I'm going to just give you, a Z-Pack, or I'm going to give you an antibiotic and you'll be fine. I mean, that would be crazy. They sit with you. You talk about what your problems are. What are some of the symptoms? The doctor will do a diagnostic test. They'll check your blood pressure. They check your temperature. They check your heart rate. They do all these little check your vitals. And then after they get your feedback and your symptoms, then they diagnose whatever drug for you or whatever treatment plan. You need to do the same thing as a sales rep. Okay, guys, it's very similar, right? So why would a doctor not be effective if you just came in and he goes, nope, I think I know what's going on, and just gave you a drug? Of course, he'll be very ineffective. He would misfire all the time. He doesn't even know what your symptoms are. And this is what you guys do. I've done it too. So I'm not just blaming everyone out there. I've done this a million times too. Walk into a doctor, assume I know what the problem is because the past 5 doctors have talked about their issues. And then all of a sudden I start spitting out the features and benefits. I'm not diagnosing anything. So that's a problem. And you wonder why doctors don't get back to you when that happens. You wonder why. I've called on this guy 50 times. What the hell, man? He knows everything about my product, but I keep going in there and I keep talking about all our features and benefits. I know he has patients that meet this criteria, or I know he has patients that would do well with our device. Why doesn't he listen to me? How come he hasn't set up a case yet? How come he hasn't prescribed the drug yet? That's because you never diagnosed the problem. You didn't ask enough questions, guys. So don't assume every account needs the same approach. You need to study your territory before you're making moves. Okay. So overall, we'll look at it more of a macro level. Overall, you need to be looking at, where's your current revenue? Where are your opportunities? Where are the accounts that are at risk? And where did you lose business? And any accounts that have been untapped. You need to break it down into different categories, guys, because everything you need to take this macro approach at first to see a lay of the land. Okay, you need that first to start. Now you got to start strategizing. You got to start strategizing your routing plan right off the bat, because a lot of us, we just get in the car and we go to accounts, and then we'll just pick accounts in that certain area, and then go to another section, pick accounts in that certain area. Guys, you got to be more effective than that. And I'm not saying just drive up and across your territory and not be effective when you're in an area, but you need to know where you're going. Can all you on that are listening in right now, can you tell me that you know where you're going the next 2 weeks every day? I'm not talking about having a case scheduled here and there and meeting with a patient here and there. I'm not talking about the true things that are booked, but do you really have a good routing plan? Because I'm telling you now, guys, the top performers do. They know where they're going. They don't just go randomly to accounts because it's the next account in line. There's a strategy. If their accounts are at risk, they have business that they're losing, they're in those accounts. If there's opportunities to grow right now, they're in those accounts. They're not wasting time with doctors just because they're friends with them. So you need to diagnose what's going on first before you actually go out there and start making an impact. So once you understand the territory, the next step is deciding where to focus your time. So prioritize your high impact accounts first. Okay. Not every account deserves the same amount of attention, guys. And you'll find this, one of the things that I struggled with was going where doctors were nice to me. It felt good. And you're going to see this, a lot of you guys that are either in the industry or you haven't broken in yet, especially for the ones that haven't broken in yet, you're going to gravitate towards the doctors and accounts that are nice to you. And there's a reason why a lot of times they're nice to you, is because not a lot of reps are going in calling on those same doctors. And I'm generalizing, but a lot of times, I'm not saying every time a doctor likes you, it's because they're not an important account or anything like that. But when I started, a lot of the accounts that had the doors wide open, the doctor could see me in the back. He would spend 15, 20 minutes with me every time I came in. There's a reason, guys. They're not that busy. And I felt good, so I would keep going to those accounts. I would try the bigger accounts, but I'm like, screw this. I'm not going to waste my time for the fourth time, this past month and get the door slammed on my face. So now when my manager would ride with me, I would take my manager to all these accounts. What do you think my manager said at the end of the call? Joe, do you even know where you're going? Right? Because we would look at my CRM data and you would see all the scripts in my territory, the accounts that I was effective in, that I got access in. They were all low volume accounts. So it didn't matter what I did there. They didn't have much potential. And you're going to see, guys, you're going to fail quickly, because if you just keep going in a direction just because they're friendly, that's not the best approach. You have to go where the opportunities are. So if an account has major growth potential, so for me, just to give an example, if you have some penetration in an account, for instance, we'll stick on the pharma side. There were doctors that were decile 9s and 10s that actually did use our product a couple of times. These are great opportunities, guys, because they already have familiarity with your product. They like it for a reason, and they have a ton of potential to grow. For me, those are the highest priority accounts. Those are true growth accounts. So a lot of times you don't want to be confused with just because they're a decile 10, you go to all the decile 10s. You got to factor in a lot more information for it to be a real growth account. Because a lot of times decile 10s, they might not use you at all. They're a closed account. You're never going to see the doctor. You don't want to waste time in that direction. I'm talking about where do you have a real potential to grow? And those are the accounts you want to prioritize first. Other accounts, you need to protect them from competition. These are your high volume accounts. So the doctors, you don't want to sleep on just because Dr. Jones loves you and he uses you 80% of the time. He's your top prescriber. You don't want to just say, I'm good. Dr. Josen's fine. He's never going to use anybody but me. Never. Guys, that account could be at risk because believe me, just like you're going into those other accounts to try those growth accounts, your competition's in there too. And they want Dr. Jones too. And if you sleep on them, you take time away from Dr. Jones, they're going to come in and get that business. And you don't want that because you could see your numbers drop drastically because those are typically your base accounts that are always there month after month. And they're given the base volume that you have to help you go higher in the rankings. If you lose that and start losing market share, you could see yourself drop drastically, quickly. I've been there, done that. So make sure, don't get comfortable and think just because the doctor loves you and you got good market share that you could just take some time off from them. You still have to make them a top priority. Like I said, we talked about the relationship heavy but low volume. And then some accounts right now, they're just not worth chasing. They're just not. You know, they could be high volume, like I said before, but you have completely no access. You don't have budget and they have a 50-person office. The only way to see them is to do a $700 lunch and it's going to crush your budget for the quarter. You got to prioritize. You do have to treat this like it's your own business, guys. Now, I've run my own business and I've been in the field. I know they love using that line. I don't really love the line of treat it like it's your own business, treat your territory like it's your own business. But I get what they're saying here. You do have to budget your budget dollars. Put your budget dollars where you're going to grow. You don't want to just waste money just because it's the decile 10 and you spend 3 months to get into that office, but it's going to cost you a third of your budget or a quarter of your budget. You got to be strategic. Can you use those budget dollars to get in front of 10 more doctors that can use you and do a lot more potential? Because a lot of those big high volume accounts, they got people in there doing lunches every day, and you don't want to waste too much time and effort if it really is a closed door or if there really isn't a need for your product in that practice for any other reasons that you find out. So sometimes they're not worth chasing after. So what I would do is rank your accounts by 4 different categories. Number 1, the opportunity, the influence, and that's the influence that you have in that office with the physician, with the staff, the access, and the urgency. Okay. Some doctors, some accounts, there's no urgency to switch. They just don't have it. Some, they could be very upset with another company, and now's the time to get in there. I've seen this many times, guys. A rep leaves, a new rep comes in, is doing a terrible job. A company changes the direction and they don't give that doctor as much love as they used to because they're focusing on other products. There's poor reporting on a different drug where there's, whatever studies come out that are non-favorable to them. So this is a time of urgency to get in there and be able to make an impact quickly. So you want to measure those 4 criteria when you're ranking your accounts. So at the end of the day, guys, you want to spend your time which can produce the biggest return on investment. It's just that simple. And at first it's going to take time. I'm not saying that you're going to go out there tomorrow in a brand new territory and then be like, I know exactly where I'm going. I'm just saying I would rather see you your first day in the field, spend it with your manager, spend it in a Starbucks, spend the first half of the day strategizing. I'd spend the first couple of days strategizing, just getting out there and just going full speed ahead. It's always not, I used to think that was the best approach. It's not, guys. You need a strategy first before you get out there. So it's okay to sit back first, strategize, and then have a really good plan of attack before you just go out there and just start running, with the chicken like its head cut off, because it doesn't work that way. You're not going to be effective. So at the end of the day, it's not about being everywhere. It's about being intentional. Okay. So after you know where to focus, you need a plan for each account. So this is where, getting back to being that territory surgeon, you need to build an account treatment plan. Okay. Every account is different. If you go in there coming out of training and thinking that everything that they just taught you is exactly what you should do, like a robot, into every account. Keep repeating that same line. Be a walking billboard. As long as you keep spitting out the features and benefits, it's going to work. Keep talking using these same sales points on the detail aid. Guys, you're going to fail. You need to diagnose and come up with a treatment plan for each account. So just like a patient, treat each account like a patient with a specific condition. Okay. So you need to know exactly what's going on in that account. What's going on with that patient? Again, every patient, they have different ailments, different comorbidities, they have a totally different makeup. So you have to treat them with an individual treatment plan. Do this with your accounts. You need to know who the decision makers are, who the influencers, the gatekeepers, and end users. Especially when you get into the hospital space, guys, hospital space is very tricky. When I called on anesthesia and accounts like Hackensack Medical Center, they have 70, 80 anesthesiologists on staff, 70, 80 attendings, just anesthesiologists. You know what it's like to get to navigate that space and find out who the real decision makers are, who really is driving the revenue with your product. It's not easy. So if I go in there with that same approach, like I did for one of the community hospitals that only has 8 or 10 anesthesiologists, it's not going to work, because you can't just go by titles. For instance, at Hackensack, if you just say, well, I'm going to focus on the chief. The chief back in the day at Hackensack, he was more of almost like a politician. He dealt with higher level initiatives at the hospital. You're not going to see him in every case every day. He's not going to care what neuromuscular blocker you're using, what benzodiazepine is being launched, whatever anesthesia agent. He's not going to care about that stuff. That's going to focus, at that account at the time was more the vice chair who had more of a say. But then there were other individuals that ran different programs, throughout the department, that they can really be effective, utilizing your product and influence other doctors in the hospital. But if I came with that same approach, it's not going to work. So I had to find that out by asking questions, by being in those accounts, by having good clinical discussions. You're able to uncover that. Next, so you have to decide what action is needed. Whether it's education, a trial, are you going to continue to build relationships, and lastly, competitive displacement. So write down the next step for each priority account and develop a clear action plan, so you prevent random activity. You don't want to be busy going nowhere, and it's easy to do that in these territories. You can run around like crazy. You can waste a lot of time. If you don't have a game plan, guys, it's going to fail. So just because you're busy doesn't mean you're effective. I remember one of our buddies told us with our business, we were busy, and he actually said to us, he said to one of my partners, he goes, "Are you guys busy, or are you busy making money?" And it was just an interesting way, the way he put it. It was simple. I was like, wow, no, we actually are just busy right now. We weren't making enough money yet. We weren't really getting rocking and rolling yet. In time, obviously things got better and we figured it out. But at the beginning, you really are. You're just busy. When I first launched RepPath, I was just busy. I'm on the phone with people all day long, between clients, between reps. And I'm like, but am I really generating money? And I wasn't at first. And then as time came, it starts to grow. And then you know what to do. You know who to waste, who you're going to spend your time with, and who you're not going to let them keep you on the phone for hours at a clip, because you're just wasting time. You have to run a business. You have to treat your territory the same way. So, but again, a plan only matters if you execute with precision. And that comes up with our next point, which is operate with precision. Just like the precision in an operating room that a doctor has to have, you need to make sure that you don't waste any moments, guys. A lot of wasted time. Don't waste time. So every call, visit, email, follow-up should have a purpose. One of the things you want to stop doing And we all do this, just checking in. Pop in the office. Hey, Joe, what are you doing there? I was just checking in. Just thought I'd say hello. I've said it a million times. Sometimes I still catch myself saying it. You send an email to someone. They haven't gotten back to you. Hey, just checking in. Guys, stop doing that shit. All right? It's tired. It's lazy. You just think that because I go in there that the doctor is going to use me. I mean, I know a lot of people do that. They think that that's effective, and it could work sometimes. They could say, oh, shit, Joe's in here. Yeah, maybe I can use his product on this next patient, or maybe I'll book a case with him. I haven't booked one with Joe in a while. He's a nice guy. Guys, but that's no way to really build a territory. It's not going to work. You have to come in there with an intention. Why are you there? When you pull up to an office, if you don't have a reason to be there, what the hell are you doing? If it's just checking in, you got to get more creative than that. You have to have some sort of purpose to be there. Or don't walk in. Don't waste people's time. Because if you do that over and over, you're going to see your access starts to come down, down, and down. You'll be like, why? What did they change the policies here? How come they're not allowing me in the back anymore? How come Dr. Joe and I always seem to miss him? No, it's because you're not bringing value. And that's what good reps do. They know how to act with precision. Okay? So know what you want to accomplish before you walk into the account. Prepare the right message for the right stakeholder. So you don't want to just go in there with the same message for the office manager as you do with the doctor, and you'll have a different one for the nurse and maybe a different one for the gatekeeper, for the front desk person. Who knows? I mean, definitely in the hospital space, we've seen this many times. You're going to have more of a clinical message for the physician and then more of a business financial message for the administration or the CFO or whoever you're meeting with, maybe on the supply side. They're not going to sit here and go, yeah, Joe, tell me all about the clinical effects and the adverse events of whatever drug or whatever product we're using. They're going to say, no, how much does that cost? Okay, I need to know how this is going to affect the bottom line. I just can't say yes to every new product here. That's if you're talking to a CFO or an admin, supply chain person. But now if you're talking to a clinician, it's obviously more clinical. If you're talking with a nurse, it's going to be clinical, but also about workflow. Because anything you implement that's going to screw their day up, make it harder, trust me, they're going to care. You're not going to care so much about price. That's not their job. Once the product is in there, they'll use what's best for the patients, and they want to use the stuff that's most effective. If it adds 25 steps in their day, guys, trust me, they don't want to use that thing. And they will tell the doctor. You'll hear them bitching at the doctor going, oh, I got to do this. I got to prep that. This thing is taking me forever. And if it delays cases and slows them down, they're not going to use it. So you have to have a different message depending on who you're speaking to. This is what we're talking about with operating with precision. You need to be precise in your conversations. You might have 4 or 5 different conversations prepped before you walk in there. Because depending on who you see, some days we're always in there trying to see the physician. How often do you go in there and say, you know what, today, no, I'm just going to make sure I get this message across to the nurse, or I'm just going to speak to the office manager. Believe me, a lot of times you walk in there and speak to the gatekeeper and give the gatekeeper, potentially something that can help their workflow. Because sometimes the gatekeepers, they have multiple duties. They're not just taking patient names and just making sure you're the next one to go and see the doctor. No, a lot of times they have things on the schedule that affects them. They're also working with patient charts. They can be doing, prior authorizations, things that take time. So you need to find that out and spend some time with each of these individuals, because I'm telling you, you're going to be a much more successful rep if you do so. But to do that, the precision, just like with a doctor, it requires that you know the anatomy of the account. Okay. So what does that mean? You need to understand how the account really works. Okay. Every hospital, clinic, practice has its own internal structure. The person using the product may not be the person approving it. And this is so important, guys. Just because it's a doctor, especially in a hospital, they might not have the final say. They could be dictated to by administration, by the executives in the department. They could say, sorry, guys, we only have budget for this, and they have to use that. And they can't use a certain product anymore. Or sometimes the nurses can tell the doctor, can you use this product? It makes my life easier. I don't care what I use. To me, it's all the same. And believe me, I've been in conversations with, I've heard doctors say that. There's 3 or 4 products that all do the same in their mind, do the same thing. So they're going to just say, fine, if that's easier for you, then that works with me. Or it could be the rep. Like, oh, Dr. Jones, I can't stand that rep. He makes my life, he's rude to us. He's a pain in the ass. Whenever we ask him to do anything, he doesn't follow up. I mean, they could say this. If they go, really? Okay, fine. Then call Susan. Don't call Bob. Right? So you need to make sure you have a clear understanding. Another quick example, when you're calling on a doctor's office, sometimes the doctor is married and the office manager is his wife, or vice versa. The wife is a doctor and the husband's the manager. Now, they will have, trust me, because I've been in these situations many, many times, they're going to have a lot more say because this is their business. It's essentially their family business. They're going to have a lot more say than the average office manager. So you need to know that and approach that differently. You need to make sure that you're having conversations with those individuals with any decisions that are going on, because if you don't keep them a loop in the process, they can easily just go in the back and say, we're not using that rep. I don't care. I don't care what, if you didn't educate them, they could say, no, we're not switching. We're going to stick using what we're doing. So you need to make sure you understand the dynamics and the anatomy before you can actually, be effective. So like I said, know who influences the product choice between purchasing, scheduling, access, and adoption. Understand the formal and informal power structure. Learn the workflow, pain points, and politics inside the account. This is exactly what we were talking about. Workflow is huge, guys. So if you're not talking to all these different individuals, you're not going to really understand how it flows. Because one person could say to you, the doctor could say, yeah, it doesn't bother me. I don't care about adding this extra step. And again, then you talk to the nurse and you're like, he said 1 extra step. It's actually like 10 extra steps. So you need to understand the workflow and know everyone's role, because they can have a different say, and you don't want that one person to derail, what you're trying to do there. So the better you know about the anatomy, the better you can navigate that. And once you know the anatomy, you can identify where the real problem is, and that's the blockage. So just like a doctor has to deal with blockages, especially with cardiologists, they're dealing with different, blockages in the heart and during your whole cardiovascular system. You need to find out where the blockage is to prevent you from being successful in that account. So most stalled accounts have a specific blockage. They have an obstacle. So the growth usually gets blocked for a reason, whether it's access, pricing, product perception, loyalty to a competitor, lack of awareness, or no clear champion. Any one of these guys can stop your growth. But again, it's not the same for every account. One account, access can be the issue. Another one, same price product in a different account, they don't care about the price. They're fine with it. They don't blink an eye. Another account, price is everything. Joe, I know it's only 50 cents more. It's crushing us. We can't use it. We only can use this amount. We only can or budget it for this. You need to understand all that. Loyalty to a competitor. That is a huge thing. I mean, how many times did I find out that the doctor's nephew is the rep? It's a family friend. They're on their speaker bureau. You're going to see this a lot, guys. We're like, why? All they do is use this one product. Now, of course, doctors aren't going to admit that. And to their benefit, they can love the drug or love the device for many reasons. The company makes them a speaker. Now, again, this isn't kickback bullshit that, the government always tries to make it seem like everything's a kickback. It's just real. They have a great relationship. They have a great product that they like. And the company made them a speaker. And, now they're flying around the country speaking about the product. They're naturally going to be more loyal to that company because they've had great results and a great relationship. So you need to understand that. So one of the things you want to do is go on the Sunshine Act site, and you'll see how much companies spend on certain doctors. You'll be able to tell, when a company spent over 150,000 on a doctor in a year, odds are they're probably doing a lot of speaker engagements. They're flying around the country, getting a couple $1,000s a clip everywhere they speak. It's going to be tough to convince that doctor to use your product. Not saying it can't happen. You never know, but you need to understand all these dynamics before you're just wasting time in there just because it's a decile 10 doctor that I can make an impact. So at the end of the day, once you identify the blockage, you could choose the right strategy. So you can't fix anything that you didn't diagnose, guys. So after you remove that barrier, you still need to be consistent with the follow-up to keep the account healthy. So your follow-up is just like your post-op care. It's the same thing. Doctor doesn't go, case over, goodbye, never see him again. Guys, that would never work. Never work. They might not see you right after the case because you're knocked out, but the nurse will meet with you after. They make sure you're okay. If you had a surgery, you're going to be hurting for a few days. If you're an inpatient, you're going to see the doctor a couple hours later. They'll come in to check on you, or someone from the staff will. If you have a same-day procedure and you're sent home, you're going to get a call from that doctor's office later that day or the next day. The doctor follows up. If the doctors don't do that, if they don't give you that post-op care, patients aren't ever going to refer them to anyone else. They need to make sure and follow up on their patients that they're okay. You need to do the same with your accounts. So you need a follow-up, and that the follow-up is where the trust is either strengthened or lost. If you don't have good follow-up, guys, you could have an amazing case, go really well, and then all of a sudden you ghost the account because you're waiting to hear from them when the next case is booked. Or you get busy and you're focusing on all these other accounts and you don't follow up because you think, oh, why? The case went well. They're going to be calling me any day. No, you have to keep following up. Especially with a patient involved, you want to make sure to calling that doctor. How is our patient doing? How was that case go last week? I know it went well in there, but is the patient doing well? Show that you really care, guys, because it's so important. You got to consistently follow up. Especially if you're doing a trial or a demo, that is huge, guys. You want to give as much TLC as possible during trials, during evaluations. So I've learned this over the years too. Make sure you have evaluation forms set up. Have them printed out. So if you're trialing, for instance, if it's a new mask that you're trialing in a new institution in an account, and you got multiple doctors, because I had to do this in the past with multiple anesthesiologists, I couldn't go to the chief after a couple of weeks and be like, product is doing great. I have like 10 guys that love it. Dr. Jones, Dr. Smith, Dr. Anderson, they all think it's great. No, guys, that's not going to fly. I had to make sure that I am doing my due diligence, getting evaluation forms filled out where they sign it and they have the specific feedback in there on how that case went, what they recommend, what did they rank it? We had a ton of criteria on there, and I would keep all those evaluation forms and then present that to the chief when they were looking to purchase, because that's going to carry a lot more weight. Excuse me. So especially when that product goes in front of the VAC committee, and that's the value analysis committee. Now, whoever your champion is goes in with all these evaluations saying, I got 30 here from all the anesthesiologists. This is the product we need, and have all the other info, the studies and everything else. That's how you get a product approved, guys. But if you don't have that good follow-up, that good post-op care, you're never going to be effective. So the strong follow-up turns transactions, turns relationships into transactions. And just like medicine relies on data, territory management should rely on the numbers too. So use data as your vital signs. It's going to tell where you are, guys. I know a lot of us, we love to bullshit our managers, go, I don't know what's going on out there. I don't know why I had such a bad month. Guys, you should know exactly what's going on. Now, don't get me wrong. There's times where 3 of your top physicians were on vacation last month and your numbers drop. A doctor got sick. I had this happen to me. Unfortunately, the doctor got very sick. He was out for like 6 months. He was my number one doctor. My numbers started to drop. Now I had to find other physicians and cases to fill that. Luckily I did. But if I don't know what's going on in my accounts, you can't go, I don't get it. I'm just confused too. Bob or Susan, or whoever your manager is, they don't want to hear that shit, guys. You need to know exactly what's going on, especially if you're going to have a bad month. Don't hide it. Don't think your numbers aren't going to come out, or you're going to cross your fingers and things are going to change. And luckily, maybe the data is wrong out there. No, get ahead of it. Be prepared. Be like, hey, next month's going to be slow. I know it because Dr. Smith was out, or this new, we had a new competitor come in where they're trialing this competitor for a month at XYZ hospital. I mean, these are things that really happen. But if you really are able to diagnose and utilize that data, it's going to tell the story. So whether it's revenue, growth rate, activity, conversion rate, product usage, account penetration, these are all your vital signs. Don't wait until the end of the quarter, guys, to start checking your numbers. You need to be evaluating your numbers on a daily basis. Just like a doctor, just with the doctor with his patients that are in the hospital, they're not checking on them once a month or every couple of days. Anyone that's in that hospital, they're making sure they're checking on them, or someone on their staff is checking on them, because you need to know what your vital signs are to deal with make sure your patients are safe. You need to do the same in your territory. A lot of reps, they're not really on top of their numbers. And then they wait towards the end of the quarter, or they wait towards, oh shit, like I only have a month left. I really got to get on this. I'm starting to fall behind. I didn't realize it was only 33% to plan. No, from day one, you have to always be on top of all your numbers, because that's the way you're going to be most effective. You need to know at any time what accounts are growing, what are flat, what are declining. You want to look for patterns for wins and losses. Sometimes you'll see it happening. And if you start recognizing patterns early enough, if you're paying attention to your numbers and your accounts, you'll be able to nip it in the bud so it doesn't happen again. That's what's so important. Or even better, if you're seeing positive results at different accounts, you can duplicate that to really drive revenue and be an effective sales rep. So you got to pay attention to your numbers, guys. I can't stress that enough. Don't wait. Be on top of it. Don't ever have your manager contact you about and notice something before you do in your territory. Don't ever do that. That is a huge red flag. Just think, your manager typically has 10 to 12, 15 reps, who knows how many, that they're all watching. If they need to get on top of you and notice something negative in your territory that you couldn't catch before them, that is a huge red flag. Honestly, that's not a good territory manager. Don't try to hide it. Don't think your manager is not going to see it. Get your manager involved if you see a problem. That's their job. Their job is to help you, coach you, help guide you. Their bank account gets affected if you're doing poorly too. So it's not like they don't care. They care. Any good manager wants to know to help you figure it out so they solve it together. So be on top of it. Don't try to hide it from your manager. So lastly, we'll talk about, adaptability, and then we'll take some questions. So even with the best territory plan, you have to adjust when conditions change. So just like a doctor, you need to adjust the procedure when needed. Good reps have to adapt when the situation changes. So anybody that's not in this industry yet looking to break in, and anyone that's in the industry can tell you, you have to be adaptable. I mean, I remember when I started at Organon and we had our first realignment, I thought the world was ending. I was with my manager. It was only like a year, 8 months, something like that. And I thought he was the greatest guy in the world. And then they changed our territories. So now I got moved into a different district. And I loved that manager too. But at the time, it was like, oh my God, my world's ending, and it's just part of it. I wind up having 5 managers in 3 years, constantly switch, constant realignments, product launches. They change focus, different challenges that happen. I mean, sometimes the strategy doesn't work. A stakeholder leaves, a competitor changes pricing. So now you got to compete with that. A hospital changes policy and now you can't get in. A product trial doesn't go well. So now what do? You have to pivot in another direction. The customer's priorities shift. So at the end of the day, strong reps, they do not panic. They reassess and adjust. So adaptability is what keeps the territory moving forward. So remember, whatever it is, you're going to face a lot of challenges, a lot of problems, guys. But if you don't adjust, you're not going to be successful. You have to realize that every good rep, they're adaptable. And they get hit with challenges too. Everyone gets shit thrown at them that they're not expecting. But their ability to adapt is what makes them successful. That's what you need to do. James, I'll shut up for a second, see if there's any questions from the crowd.
You had a lot to say today, Joe. Big topic. We got some questions for you.
Then shut up.
That's par for the course. No, nothing I haven't expected at this point, Joe. Kristen Holloway. Joe, I'm interviewing for a cardiac rep role next week, and the territory has 47 accounts spread across 3 states. How do I even start to think about prioritizing that on day one?
Yeah, and it's a great question, but it's exactly what we were talking about before, where you can't just run out there and just go, I'm just going to go to the closest account and then just pick the next one after that. Sit down and really analyze, what opportunities are out there. Where are your growth opportunities and where are your accounts at risk? So the first 2 things I would do, number 1, I would see where I have business and go to those accounts first. Because this happens a lot where a rep left and no one's been in that territory for 2-3 months, and they're getting business from these top, to 8 to 10 accounts, getting good business. But you're going to start seeing the longer someone's not in there, those numbers will start to drop because other reps are coming in there. So I would make sure I am in those accounts right away, introducing myself, letting those doctors know, don't worry, I know Bill left, but I'm here. I'm going to take care of everything. If there's anything you need right now, please let me know. I'll get right on top of it. Those are the accounts you want to get into right away. That would be my first step. And then you can really analyze the other criteria we talked about, other accounts that are at risk, growth opportunities where doctors are using you, but not using you enough. But I wouldn't one of the first things I would not do, if you have no business at an account and a doctor is a decile 10, I'm not going in there just because they have such great potential overall. I'm going where we have the business and it's going well, or we did have business and we're starting to lose it. Those 2 accounts, I'm in there immediately. I would start there.
I got Cinnamon Toast Carl. Does anyone actually use those big territory mapping software things, or are we all just using Google Maps?
I mean, whatever works for you is fine, but I would start by prioritizing the accounts first, and then you can break that down. I wouldn't just, I'm trying to think of the different apps now where you can plug in the 10 addresses and map for me, or I forgot the different ones I used to use, where it basically would just make it more effective in your routing. There's a million tools for that. You could probably just put it into ChatGPT and say, develop the best route for these 10 accounts. It's not about that. That you can use whatever you want to use, but it's doing that territory analysis first and saying, okay, I'm going to make sure I'm going to these accounts and then see where they are on a map and then prioritize your day. I would start there. I wouldn't just say, well, no, that's 3 hours away. I'm not doing that this week. That's too far. Screw that shit. No, that account you need to get to. So figure out where you need to go first and then map it out and develop the best plan. That's what I would do. But whatever software, whatever works best for you, it doesn't matter to me. Whatever works. Some people, again, they can put it into ChatGPT and it's fine for them. So whatever works for you, use.
I got Amelia Afternoon 77. Is it normal to feel like you're failing for the first 9 months of a new territory?
Yes, definitely. Some people could be shorter than that, obviously. Some reps are in there a month, and then all of a sudden they start to get in a groove. Some reps start the first week, they get a big sale, or they get, a doctor that coincidentally just loves the product or was really blown away by a presentation. But it's very normal for it to take time, especially if you're in the hospital space, because most hospital reps that have experience know it could take 9, 12, 18 months before you start being effective in those accounts. I mean, they're much more difficult to navigate. A lot of times they have many more decision makers. So it takes time to figure out what the hell is really going on there. You can't just go by what people say and by someone's old notes. While that's good to have, sometimes it's not right. So it takes time to really get your footing. So don't feel like you're failing if, month after month, you're like, shit, I don't feel comfortable yet. It could take up to a year. It really could. Now, if you're still ineffective and you're getting up to, 15, 18 months and you're really not having much progress, trust me, your company's going to be on you, making sure that they're kicking you in the butt or finding someone else if you're not effective. But, to be in there your first year, especially if you're breaking into the industry, it's very normal because it does take time, guys. They're not easy jobs. They're not. I mean, that's why they pay well. These companies, these sales reps out there, they're high performers. They're all smart individuals. A lot of them could have gone to and done other careers, like being a doctor, like being a lawyer, and have gone in these other professions. They like medical and went down that path and wanted to get into sales, and went down a path, but they're very smart. And even these individuals, it takes time. So don't kick yourself in the ass if you find yourself in that situation.
We got Mikey Boy 92. What if you inherit a territory with zero documentation, no notes, no nothing? What does day one look like?
Yeah, well, first thing I would do is get my manager. That's the first thing. I mean, they have experience with whatever company. They'll be able to direct you based on different, numbers that they may have from other territories. If you're at a small company and there's no information, nothing to go on, you can't even find anything online about doctors. I mean, then you just got to go hit the ground, and just, bang on doors, get in front of doctors that are on your call points. If you're calling on cardiologists, start calling on cardiologists. I mean, sometimes there is no data to go by. If it's a startup, if they don't have any information, just go out there and start knocking on doors. It sucks. It's not fun, but you're going to learn quickly. If you're out there every day working your ass off, getting in front of people, you'll know within the first couple of months where you're going to spend your time, and where you're not. So sometimes it just takes that. If you don't have any information, you got to just go knock on doors.
Colby Codes 22. Do you account plan with your manager, or do you just kind of show up with one done?
No, you definitely account plan with your manager. If you're just starting out, definitely get your manager involved. Guys, that's what they get paid for. Now, you don't have to every single step, every little thing you do, be like, hey, Bill, is this okay? Is this okay? I mean, you don't want to be annoying. I mean, you got to make executive decisions here in your daily process. But when you're first starting out, your manager is going to want to be involved anyway. Keep them involved. Ask them their opinion. Make them earn their paycheck, because that's what they're there to do. They're there to help coach you and guide you. And they're supposed to be the expert. They're in that position for a reason. They were successful at some point in their career to get that role to lead others. So make them go out there and lead.
We got, it's just Priya. Is there a way to politely tell your manager their pipeline reviews are eating your selling time?
Well, I mean, I think transparency is always the best way. So if you don't want to complain, for me, I'm all about getting criticism too from my team too. I wasn't like, guys, this is the way we're doing it. I don't give a shit. No, if there's something you don't like, tell me. So if it's not working for you, let's talk about it. But you you don't want to go to your manager and say, this sucks. Okay. This sucks. I don't like the way we do this, without a solution. I don't care if someone says, Joe, this sucks. Can we do it this way? I was thinking this could be more effective. That's fine. Have a solution though. Don't just come in and say, it's annoying that we got to do these reviews, or it's annoying that we always got to do a territory planning. I don't want to keep doing these. Like, no, guys, there's things you have to do for your job. And more often than not, it's not your manager that's the one that just wants to do busy work. They're being told to do this by their directors or VPs. So come with a solution, a different option. That's fine. If you don't like the way things are working, if it's affecting your day, just talk about it, but make sure you have a different option to use. Because most managers, if you just say, this is annoying, I don't want to do it, that's not going to go well. It's going to be a bad conversation. If you have a solution, most good managers will be like, let's talk about it.
We got Andrew Pellegrino. Joe, when you're assessing a newly assigned territory, what data sources do you prioritize for white space analysis beyond the standard CRM exports?
So number one, access. Access is key. If these doctors have all huge potential, but there's no way to get to them, you want to know that. You want to make sure you're into that, have that in your analysis. Like we talked about before, the opportunity, growth potential, one's at risk. Want to make sure that that's all in there. And then also you could have access, but does it eat your budget dollars? So again, some of these territories, I know accounts, they only get like $2,000 for the quarter. So $2,000, guys. I mean, there's some offices. I mean, you guys go out to dinner with your family. James, how many times you go out to dinner and you spend less than $100 a head? It's hard now. Like
today, it's next to impossible.
Yeah. So either you don't go out, you make your own food, but anything you do, it's going to cost money. So anything with an office, it's going to be a couple $100. So you have to make sure, is this worth it? And evaluating, break down your budget dollars, because you'll know once you start getting a good hold of your territory, you're going to have your budget dollars spent in your mind, that I know I got to save 500 for Dr. Smith. I know I got to save 300 for Dr. Jones, whoever it is. You'll be able to have a good territory plan. So you're not just wasting money on anyone just to see them. So I would factor in all those things, because you're not going to typically see that in a CRM report. This is going to come with knowledge of the territory, either from someone prior or from your manager, or you have to figure it out on your own.
I got Hannah Kowalowski, I guess is how you pronounce it. I butchered that. When evaluating candidates for territory positions, how much weight do you place on prior territory management experience versus raw selling aptitude?
Well, it depends. I mean, obviously, if someone has worked in that exact space, in that exact territory for, say, a competitor, and they've been very successful, and they can walk me through a territory strategy with the specific doctors that they have relationship with, that's going to be tough to compete with. But a lot of times, guys, especially if you're coming from this is Hannah, if you're coming from a different field, a different industry, you got to show your transferable skills and how you were able to be effective managing, a business in a different sector, and just show how it correlates on the medical side. So it's not always about, I know how to call on doctors. Like they're these unique individuals that no one can speak with unless you've been in the medical field. It's just not true, guys. At the end of the day, we work with so many individuals from different industries, and I've seen every day that they're super successful because they know how to deal with customers. They know how to adapt. They know how to influence. So utilize your transferable skills, and that can help them show that you could be effective in any territory. But you got to be able to verbalize that in the interview and talk about specifics that you've done in the past to be effective. Because it's not always about, this person has experience with these doctors and has relationships. If they can't walk me through a good game plan and a good strategy, I don't want them. I'd rather have someone that came from Enterprise or ADP that walks me through their strategy and shows me how they were effective in a new territory and how they approach that. Because that's why they love a lot of these B2B reps. There's so many similarities that happen in the B2B role that they can translate into the medical side.
Greg Pemberton. My manager wants me to grow a dead account that's been called on for 8 years with no movement. At what point do I push back and reallocate that time?
Well, I would, and that's a great question too, Greg, because this happens a lot. I don't know about 8 years, but there's accounts that your manager wants you to go in that you're not as much of a believer in, or you don't see the reasoning. Again, you don't want to go in there and say, I don't want to call on them anymore. It's a waste of time. You could say, yeah, that's fair. We'll keep trying to come up with a plan, but here's where I see my time better spent. And talk about the accounts that you do believe you should be in that will drive revenue. Because I've been in these situations. For instance, I talked about this on a previous podcast. I had a young internal medicine doctor that didn't meet the criteria. He was a new doctor in the area. I had to actually enter him to my CRM. He wasn't even in there because they didn't even have his MPI number yet. Brand new, but talked to me, because we had a conversation, and he loved my product Avinza at the time. Thought it was great. Thought it would be effective because it was a once-a-day product. Like everything about it, he loved. Turned out to be one of the highest writers in the country. And my manager at first was pissed off that I spent money on someone that, is so green when I could spend it in other directions. We had a conversation. I talked to him about why I thought he would be a great target. And it wound up really working well for me. And he wound up, saying, Joe, you were right. I was wrong. But at the end of the day, even if I was wrong and he wasn't as effective, at least I had my justification. I had reasons why. I didn't just say, no, I got a feeling, I got a hunch. No, you talk about exactly what we talked about. He talked about specific patients. We got into detail. So that's why I was so confident that even though he's only a decile 4, he wound up being a decile 10 in time. But that's why I knew, no, this is the right direction we want to go in. You need to have that for your doctor, for your manager. Not so much, no, I don't want to call on that doctor. Someone's been in there for 8 years. It's a waste of time. Say, no, but I think I'd be better spent going on these accounts because of X, Y, and Z.
Joe's right every once in a while, ladies and gentlemen. Anthony Castorina, when you took over your first territory, did you call every account in your first 30 days, or did you focus only on the top revenue?
No, I focused on where I had business. So when I first started, I was selling a birth control called NuvaRing. And it looks like, I don't know if you guys seen this because it's been out for years now. But at the time, it was like the old Madonna bracelets that it was, just a clear ring that was a vaginal birth control. And we did have some business. So I focused there first. It was a little different. I had like 3 or 4 key doctors at the time. They were doing like 10 prescriptions a month. 10 prescriptions is like absolutely nothing today. I mean, there's doctors doing thousands a month, hundreds a month. But at the time, 10 was a lot. So that's how I focused. I'm like, I'm going to get to where all my users are first. And I had about like 35 of those doctors that actually at least used it at least once. And I was in those offices the first week. That's how I would prioritize it, especially if it's something that the drug has already been out or the device has already been out. Go where you have the least amount of resistance to start. Go where someone actually believes in your product. That's the best thing because they're the ones that are at risk. Because if you're not in there, each week can go by, you're going to see those numbers drop. I wouldn't focus right away just on the biggest doctors that first week. Go where you have some business first.
That's it today, Joe. That's all I got.
Awesome. Well, James, thank you very much. No banter, nothing. It was kind of a boring call between me and you, which is refreshing every once in a while.
I had to be a little nice. You gave me some compliments on Monday, so.
Yeah, I'm gonna come back on Monday and just to pick on you. I'll think of something, man. Especially if the Knicks,
plenty to think on. Let me tell you, Joe.
yeah, I guess you know what, the Knicks and Yankees are winning, so I'm happy. I'm not. Yeah, they both look awesome. Let's hope they keep it up. But again, guys, at the end of the day, the reason why I chose this corny, territory surgeon, but it's the truth. You really got to take it and just don't dive into your territories. Be more precise. Treat each account differently, and you're going to be more effective. Don't just go in there with that same tired messaging just because the company tells you that this is the right thing. You need to diagnose and know what's going on at each account and come up with a specific plan, and then go even deeper and have a specific plan for each individual customer within that account. But as always, guys, make sure the RepPath Academy, go on reppath.com. Lastly, anybody that is looking to sign up and is a lobby member, make sure you give the promo code Licata. It's right there on the screen. When you message me, give me that code and you'll get additional discounts. Other than that, guys, our last call for the week. We'll be doing them every Monday and Wednesday at 3 p.m. Eastern. Hopefully, I'll see you all on next Monday, the 11th at 3 p.m. Thank you, guys. Have a great weekend and take care.